Hi, I'm Stephanie Shelton, and this is Conversations on Health, How We Get There, episode 33. It's no secret that our population is aging fast. According to the US Census Bureau, 10,000 baby boomers hit that 65 landmark year each day. In fact, 2025 is projected to be peak 65 demographically, with more than 11,000 boomers crossing that daily line. Unfortunately, as we age, more of us develop dementia and Alzheimer's, with most of the associated costs paid by Medicare. It's estimated that for Alzheimer's care alone, costs are as much as 2.8 times higher than for other seniors. So Medicare has begun an experimental program. It's called Guide, partnering with some private, digitally oriented companies to create better dementia outcomes, both personally for older people and their caregivers, and financially for Medicare. One of those companies is Tembo Health, founded and run by Dr. Anurag Gupta. He's a practicing emergency physician with both an MBA and an additional degree and board certification in Clinical Infomatics, and lots of real-world experience at a lot of really good hospitals. The concept of public-private partnering in healthcare isn't new. But certainly it's not every venture capitalist financed startup which hopes to make its mark with dementia care. So here's my really useful conversation with Dr. Anurag Gupta. Anurag, so happy to have you on the podcast, and I really appreciate your time.
Yeah, it's great to be here, Stephanie. Thank you for inviting me.
Okay, so let's kind of start at the very, very beginning. You started professional life as an emergency physician, I believe. How did you go from that to putting together a company that's going to help people with dementia?
Yeah, that's a great question. And I feel like I could probably speak for hours just on this one topic. But I think from a young age, I've always just been a tinkerer, problem solver. I remember even during my time at medical school, when I was at the University of Michigan, Ann Arbor for medical school, I I was learning medicine. I was learning it from some of the brightest minds on the planet, but I felt like there were just real issues that impacting our patients. The term social determinants of health had it been created back then when I was in medical school in 2004, as an example. And that ultimately drove me to launch my first startup when I was in medical school. I was trying to, support patients dealing with, certain types of diseases. It was in the addiction space, where there wasn't a great healthcare ecosystem to support patients with addiction. And it's something that I was just, motivated to try to solve. And so I think early on in my career, I wanted to just kind of figure out how do we help real people, right? It's not just the diagnosis and the treatment and the medications and surgery. It's everything. You have to think really holistically about the person and society and the impact that we're all kind of having across the board. And so I've always kind of been thinking about it from that perspective, and I think that's what kind of led me into my path beyond just medicine. Pursuing an MBA so I could like learn more about the business side of
Yeah.
things and be able to speak to administrators who are ultimately administering access to healthcare resources and so forth as my original drive to do that. And then after my residency training, I did a postdoc in bioinformatics so that I could then learn the IT side, the technology side of healthcare as well. And that really kind of pushed me, quite forward into thinking a lot more about startups and technology and how do we leverage meaningful technology built for populations, especially older adults, to support them. And really with the current company, Tembo Health, big driving force was experiences with my own family members.
Yeah,
Our
I know there's something on your
yeah,
website to that effect.
Yes, I come from a family of physicians. My father's a physician. Both my sisters are physicians. I'm a physician. Um, and yet, we struggled to kind of support, my grandfather and some other family members in our family with the right clinical care needs, caregiving needs, coordination of care as they were aging. And I felt like we as a society can do better. And so that was really my driving force for starting Tembo Health. Tembo is Swahili for elephants, and
Ah,
elephants are one of the few animals on the planet that care for their elders in nature. And that just resonated very strongly because I was very focused on, serving this, older adult space. And so Tembo just seemed like a great name there. And, from day one, our mission has been how do we support older adults to stay healthy, happy, and at home through meaningful technology that's been built for that population.
How did you happen to settle? I mean, plenty of older adults have all kinds of diseases and all kinds of issues and multiple diseases in many cases or conditions. How did you settle on dementia? Because it obviously is among the most likely to grow and grow with the aging population because we now have the huge baby boom population retiring and we all live longer.
Yeah. So, I think, with my own family experiences, um, going through, you know, open heart surgery, severe cardiac disease, cardiac rehab, and so forth. There's a formula for that. It's very challenging. It takes a lot of resources, a lot of motivation. But if you go through that formula or playbook for cardiac rehab, most people should be able to return to their baseline functionality, from before having major open heart surgery.
Yeah.
But when it comes to dementia, there's no playbook out there. There's no resource guide.
There's no
Most primary,
return. There's
yeah,
no
and
return.
there's no return to baseline either. Of course, yeah, it's an ongoing chronic condition that's generally getting worse over time. But in particular, you know, most physicians aren't even trained to diagnose dementia,
Mm,
to manage dementia. And so what happens is, for families who are, and I think, the toll of dementia really does fall on the families and the caregivers. They're really left at a loss. People are online looking at Dr. Google. They're trying to find, local support groups to kind of help them figure out what worked for your family. Maybe that'll work for my family as well. And so
yeah.
there's just been this ongoing lack of clinical and expert attention to supporting this population.
All right. So there's a need for essentially someone to create a program that works for most people at various stages of dementia, at least a loose program. How did you hook up with Medicare and this guide program, which, as I understand it from my cursory reading from the Medicare site, is basically not quite as I speak, a year old.
As we've been building Tembo, our first product to market was a 24/7 virtual ER platform
Mhm.
built specifically for older adults and especially for those with dementia. And so through that product lens, we've had the benefit of interacting with like thousands and thousands of uh, frontline care staff, patients, families, caregivers, primary care physicians, and I'm very biased. I think we've built a really great platform for virtual ER. We consistently show 75% less transfers to the ER and the hospital for this older age population with dementia. But in those conversations, we kept kind of hearing how dementia itself was still a huge problem, a lot of complexity, a lot of broken processes out there. And so that really spurred us to launch our second product, which is now a virtual wraparound care model for dementia, where we're really supporting the patient, the family, the caregivers, and the primary care physician through that journey of dementia from pre-diagnosis through the end of life. And as our team went heads down and started building this product and doing all our user research and so forth, we had no idea that Medicare in the background was working on the guide program
Oh,
and was going to launch it. And so we had come up with a business model as we were bringing our dementia solution to market to do what's called value-based care, where our goal was to work directly with the Medicare Advantage health plans, where because we know Medicare had no reimbursement codes for care navigation for dementia. So we knew we had to go
uh-huh.
directly to the Medicare Advantage plans, and that was going to be our go-to-market strategy. As we were preparing for that, Medicare announced the guide program. And so, to be honest, we were at the right place at the right time. And sometimes they say that, when when luck knocks on your door, are you prepared to open it and walk through? And
Exactly.
we absolutely were at the right place, the right time. And so we were able to, apply for the guide program. It was a very competitive and rigorous application. And we feel truly honored that, Medicare selected Tembo as one of the main participants for the program.
And how do you feel? Obviously, all of this happened prior to President Trump taking office, and the Doge cuts and everything that's come since then. Um, how do you feel about the possibility of this? I mean, if it's an experiment, I know Trump has said over and over, we won't touch Medicare, but this is an experimental program. I think it has two directions, two lines that it's going in. Um, and if Medicare itself says, well, okay, we don't have the money for this, how comfortable are you, because you're right at the beginning of this, that you're not going to leave a bunch of older people in the lurch?
Yeah, great question. And so we have kind of dug into this topic to some level. I'm not a policy expert by any means, but so on the first hand, dementia care has become the most expensive chronic care condition that Medicare is paying for today. Historically, that's been kidney care, chronic kidney disease.
Yeah.
15, 20 years ago, Medicare launched very similar innovation programs for kidney care as they've launched now today for dementia care. And those kidney care programs have worked. And I think in general, the Medicare innovation team has a very strong record of success over the last 50 or 60 years for delivering and driving innovation and investment in the biggest needs for the Medicare healthcare population. Um, and so in 2024, as an example, last year's data, Medicare spent a total of about $100 billion on the total affiliated healthcare costs for chronic kidney disease. But Medicare spent $360 billion on the total affiliated healthcare costs for the dementia care population.
Wow.
So it is really ballooned. And by all the independent analyst reports that are out there with the aging population, a common statistic is that 10,000 baby boomers turn 65 every day.
Yeah.
There's also 10,000 baby boomers who are turning 70 every
Yeah.
day in America as well. And in a couple of years, we'll have folks turning 75 every day. And so with the demographic changes and some other independent factors, the independent analysts have had all the reports are indicating that the total cost of dementia care is going to balloon to about $1 trillion by 2050. And so if we don't get ahead of this issue, um, it's going to have a massive impact. And again, I'm not a politician, or I honestly don't read too much into politics, but my general understanding is, the current administration is very focused on decreasing cost burdens. And so
Exactly.
to my understanding, the GUIDE program is the only thing the government currently has, Medicare has, to help address the cost burden of dementia care. And the program is intended to, not only improve access, improve outcomes, but also reduce cost. And so
All
I think
right,
from that
let me
perspective,
stop you right there and
yeah.
let's just talk about that. How can you reduce? I mean, there's been a lot of talk. I do podcasts on healthcare systems in other countries. They're all state-run. We are the only country without a state-run system, except for Veterans Affairs. Um, And everybody is talking about the same thing. How do we reduce it? There is a private level in most countries, but it's not always connected in any way. Is this the time for a private-public partnership, which is apparently what you're doing? Because I don't know what it is about government or what it is about private companies, but it never costs a private company as much to do anything as it does the government, from building roads to, building a hospital. So if you can be kind of specific, why are you able to bring this down? It seems to me you offer an awful lot of care and possibilities, perhaps more than I could get from Medicare if I needed it alone. And yet you're talking about reducing costs. How?
Yeah, so we've had the benefit of working very closely with some health insurance plans in the Medicare Advantage space. So they have all the data on the patients that they're providing services for, cost. They can slice and dice it by diagnosis and so forth. And so what we've seen is that the average Medicare aged patient with dementia is costing, anywhere from $35,000 to $45,000 per year in expense. That's a huge number. And as you kind of look into that data, one of the biggest drivers of that cost is frequent and unnecessary visits to the emergency room and to the hospital. Um, I think in addition to that, there's so many factors right now that are causing a delay in diagnosis of dementia. Again, as I mentioned earlier, most primary care physicians are not trained to diagnose or manage dementia, and wait times across the country to see a dementia specialist, are anywhere from 12 to 24 months. I know
Mm.
locally here where I live in New York, those wait times are exceeding 24 months. I've asked a
Wow.
lot of different primary care practices for that data. And so a delay in diagnosis means, you're not able to get the right treatment. You're going to have even more confusion, more ER visits, more hospital visits, and so forth. And so the guide program was really built on evidence. There's a lot of literature that's been published on the care navigation program. It's called the care ecosystem is one of the programs and that's what Tembo had, programmed our model off of. And this is open source research that was published, I think, out of UCSF. I think Hopkins was also involved. And they showed with proactive care navigation and proactive, education and tools for dementia specifically, just that care coordination can help reduce total cost of healthcare costs by about $500 per patient per month.
Mm.
And so that's $6,000 right off the
A
bat.
lot. Yep.
And I think that's to my understanding, that's what the guide program was kind of based on, is to kind of demonstrate that type of savings. At Tembo, we very uniquely um, also include 24/7 virtual ER as part of our program here at Tembo Health. And I think that's very important as a physician myself, as an ER trauma physician. I really want to make sure that we help break that cycle of frequent, unnecessary visits to the emergency room. It's bad for everyone, especially the patient, because they often leave the hospital delirious. When you take an older adult, especially one with dementia, out of their home setting, they get confused,
Yeah.
and that exponentiates with every hour. And so with Tembo, our goal is to demonstrate cost savings that are much, much higher than the $6,000 per patient per year. Because if we can directly prevent 75% of those unnecessary ER visits, that should take a huge carve out of that 35 to $45,000 annual expense.
And also, among certain groups of people, particularly older people, they may not have regular doctors of any kind, and they use the
Yes.
emergency room as their doctor. If they have a sniffle, they go to the emergency room. So there's that history in their family. Um, and the other issue is, and I don't know if your program can address this or not, but there is a familial distrust of healthcare and healthcare systems and doctors in general in some families, in some areas of the country. How do you go from that? And that is the emergency room, scenario. I only go when I have something terrible happening to me, to your very orderly program.
Yeah, great question. So, first thing is we don't provide primary care. So we're very clear in our communication as we're interacting with patients, families, caregivers, and so forth. But we know how important and valuable it is to make sure that patients are engaging with their primary care physician. And so that's part of our foundation, is to make sure that patients have a primary care physician. And if they don't, we can help them find someone to meet those needs. Because we tell patients, we're here as your dementia experts, but whether you have high cholesterol, hypertension, diabetes, heart disease, you need to make sure those things are also being managed, and that needs to be done by your primary care doctor. And so we communicate very regularly with patients' primary care physicians. We want to make sure that the primary care doctor knows everything that Tembo is doing and offering and recommending, and that the primary care doctor does remain as, the patient's quarterback. That is their
Right.
role. They're the
Right.
quarterback for your general health. And so that's an important part for us. And in terms of, working with patients and families, we really try to meet them where they are. The majority of our services are not delivered by physicians. It's mostly delivered by dementia certified care navigators. Families tell us it's like having a wedding planner for the journey of dementia, right? Your average family, from what we're seeing and hearing, is going to have 10,000 questions in the next 5 years of all the various things that come up with how to manage mom or dad's or whoever's dementia, behavior issues, clinical issues, and social issues, and so forth. And people tell us the Tembo Dementia Certified Care Navigator, they're coming in as a wedding planner because they're telling you what your questions are before you even think of them. But then we also have all the playbooks and the resources and expert um, uh, resources to really help navigate all of those things in a proactive manner. And listen, things come up reactively as well, and we also help jump in and put out fires. And again, that's why I firmly believe it's really important for us to continue to have and expand that 24/7 virtual ER platform. Because when, mom or dad, they take a fall, they have a fever, they have a behavior issue, I don't want families to feel that their only option is 911. I want them to feel like, hey, we have that resource that can help us assess, diagnose, and manage mom or dad or whoever it is safely at home. And at least historically, we've been able to do that 75% of the time.
How do
Um,
you work that out with Medicare? Just about a month ago, um, at the deadline when they had to make that decision, decided not to support telehealth any longer. So you're like in opposition to the overall object of Medicare in that sense. How do you work that?
yeah, so great question. So in terms of a month ago, telehealth has been extended for Medicare, I believe, through the end of September, end of October. I can't remember the exact dates, but they have continued to extend that telehealth um, component of Medicare. Um, that being said, the guide program is separate from general Medicare, and so through the guide program, we're still able to provide all of our services virtually. Um, and for a lot of specific patient scenarios, we'll still be able to do our virtual ER program as well. Um, I would see it as a huge loss if Medicare does, overall cut, you know, the ability to provide telehealth services for a lot of other patient needs and ongoing clinical issues because for so many patients and for so many different uh, diseases, it's very difficult to access a doctor in person, to sit in a waiting room for 3 or 4 hours, transportation issues, and so forth. And I'm hopeful that Medicare will continue to either extend or hopefully formally accept telehealth regulations.
I have difficulty understanding because to me, this is a way to save money
Yes.
in the long run. I mean, to me, telehealth is the future. And we have doctor shortages, we have nurses shortages, we have hospital problems. It's a good place to begin, it seems to me. Anyhow, okay, so to move on that, uh, let's talk about the people, the patients themselves, and the families and everything. This program works with unpaid caregivers, right? Particularly the guide program. I think that's what it says on the website, and that would be family and friends and that kind of thing.
Well, it's meant for any and all patients with dementia. There's different reimbursements, whether you have an unpaid caregiver or a paid caregiver. But anyone with dementia, anyone who has dementia and Medicare is eligible for the
Okay.
program. The three major exclusion criteria are if you're actively enrolled in hospice, if you're actively enrolled in a PACE program, or if you're actively living in a long-term skilled nursing facility. Um, but if you're in short-term rehab or if you're in memory care, assisted living, or independent living, all of those do qualify for the guide program.
Okay. Um, if somebody is just beginning on the dementia road, how do they find out about you?
Yeah, so great question. Today our focus has been in terms of growth and scale. We're taking a B to B to C approach. So we're partnering with lots of health systems, home healthcare agencies, geriatric primary care practices, senior housing, community organizations, like nonprofits and so forth.
Yeah.
Basically, anyone who's out there that's already taking care of this patient population, they're able to, we're working with them to build APIs and streamline referral processes so they can refer their patients to us. And so far, all of those entities have been super happy to partner with Tembo because we're bringing them a critical resource that they themselves are not able to deliver. And ultimately, we're keeping patients healthy, we're keeping them happier, we're keeping them at home, out of the hospital, out of the ER. So everybody wins in that regard. Everyone is incentivized to decrease, unnecessary spend on these patients. And so that's been our primary mechanism for patients learning about us is their own primary care doctors or local hospitals and other clinicians out there are referring patients to us. That being said, anyone who's listening to this podcast can go to our website right now. It's www.tembo.health. I'm sure Stefan will include it in the comments as well.
Mhm.
And you can enroll. If you know anyone with dementia, you can enroll on our website today. We work very hard to try to have next business day appointments available. That
Wow.
initial visit is totally free, no cost to you whatsoever. It's a quick 20-minute discussion. We'll spend about 10 minutes telling you who we are, what we do. We'll tell you about the guide program. And then we'll spend about 10 minutes understanding where are you in that journey of dementia with your loved one? Do you have a diagnosis? Have you seen a specialist? Do you have a care plan? How can we best support you? And to be honest, it doesn't matter whether you're pre-diagnosis or you have mild dementia or moderate dementia or severe dementia. I'm very confident that our team will be able to bring incredible value to your family. And again, if you have Medicare and you're eligible for the guide program, there's no cost, there's no copay, there's no deductible, there's no cost at all for this program. And uh, our team, we're currently live in about 45 states for the guide program, but in about 2 months. So I think by the time this podcast goes live, actually, we should be available in all 50 states across the US.
I think we all forget about that insurance plans per se, even though we're thinking Medicare, it's a federal program, but insurance plans per se are all state by state, which is what makes the whole thing so confusing to people.
Yes, lots of regulations in healthcare.
Yes. Other than that, I did notice that your website is a very simple one. It would be very easy for someone who themselves recognizes that they're in the beginning stages of dementia or whose, immediate family has begun talking to them about it, to just go in and find that button to sign up for the initial information, which I think is great. So many
Thank you.
websites make the salient part of it, which you have to go to. They bury it somehow, and you can never find it. And that's for people who know where to look, so people who
Yeah.
are not so savvy can deal with your website. Um, so we're talking now specifically about a public-private partnership with Medicare, with the healthcare system, and in the dementia area. But when you look ahead in the healthcare area, maybe not just the healthcare area, but in general, but I'm obviously focused in on that. What do you see as the future of this kind of thing? Because as I said, it does seem to me that often a private company can do things in a more streamlined, cost-effective way than the government itself can.
Yeah. So I think interestingly, with the guide program itself, even the majority of the entities that were accepted into the guide program are your traditional brick and mortar uh, providers, hospitals and neurology clinics and so forth that were accepted into the guide program. Um, and so, Tembo, we were a little bit more unique being in the program as a kind of tech-enabled, more virtual program. But I think from Medicare's perspective, we're all providers, right? Like we have a medical practice, we have our doctors, and we're enrolled in guide through our medical practice. Um, and I think what's been really interesting to see as we've been talking to a lot of the other folks who are also in the guide program is that the brick and mortar entities, the hospitals, the neurology clinics are actually struggling to take on additional volume, right? Because your average wait time out there already today across the country is, 12, 18, 24 months to see that dementia specialist. And so really interesting is because, again, because we're tech enabled, we're virtual, we can get you in front of a specialist in less than 2 weeks to diagnose mom or dad with dementia. You don't have, instead of waiting 2 years, you get that diagnosis in 2 weeks with Tembo. We've actually started receiving referrals for the guide program from other guide participants. There's a large academic hospital on the West Coast. There's another large academic hospital in the Midwest. Both are accepted into the guide program, and both are actually sending patients to Tembo. And we were very confused in the beginning, like, why are they sending us their patients? They should be doing it themselves. And so we called, and they just said, we don't have the capacity, and our model is built, in person, and it's very difficult for a lot of these patients to get transported, sit in our waiting rooms, and see us in person. Whereas, Tembo's 100% virtual, and you're in every zip code.
Yeah.
And so we just started sending you patients because it's the right thing to do. And I thought that was really interesting. And I hope that more clinical providers out there can kind of figure out how to bring in some more technology to be able to serve more patients. Because, while I'm happy to receive those referrals, we need more people out there doing this amazing work. I can't be the only one or one of a few that's able to support, the growing population of dementia.
Do you think that there is a population of younger physicians like yourself who grew up with technology, who are not afraid of it, and who embrace it, who are in their own ways, in their own specialties, perhaps moving in your direction? Not even necessarily with a private company, but just in the sense that technology, particularly AI now, has the ability to streamline everything and thus save a lot of money.
I think that there is definitely, as a culture shifts, right? Like I think one of the biggest impacts of COVID was just this national acceptance of digital health and telehealth and so forth, right?
Mm.
We started Tembo back in 2018, so before the pandemic, and we would definitely get interesting responses from some folks who felt uncomfortable with telehealth. But I think that's kind of just changed the national perspective on digital health and so forth. And so I agree with you. As we have newer, younger physicians coming to the workforce, they're also more tech savvy and more interested in using technology. That being said, I think from a personal perspective and someone who's been in bioinformatics and health IT for a large part of my career, there are just so many regulations in healthcare, which I think many of them are great, right? It's really important to make sure we protect patient data, privacy, everything is super secure. You definitely don't want your healthcare data falling into the wrong hands
Yeah.
for so many different reasons. But it's also just created this really entanglement of policies and regulations that have, in general, I think in the last 20 or 30 years, really prevented the healthcare industry from adopting technology advancements. I remember when I was doing my fellowship at Harvard back in 2012, there was all this, excitement about big data and clinical decision support. And I remember, 10 years before that, it was a lot of excitement about electronic medical records and how it's just going to like totally transform the healthcare industry. And all of those things have come and gone, and we haven't really seen any major impacts on healthcare. Doctors today are still mired with a lot of the same inefficiencies and administrative burdens as they were 30 years ago. And in fact, many physicians, like especially like physicians like my father, who are still practicing, in their 60s, they actually complain that some of these new technology advancements have actually just created more work. It was actually easier to fill out a quick T sheet, to document a patient visit versus sitting there and typing out paragraphs into an EMR and being forced to kind of click through a bunch of different screens and buttons and so forth. Actually, and studies have shown that, we've actually demonstrably increased the amount of administrative work that doctors and nurses are doing today compared to 30 years ago. And so while as a technophile myself, I'm super excited about the potential here, I'm also really worried that healthcare is just going to keep out-regulating itself and not allowing a lot of this, innovation to come into play. So let's see what
As
happens.
a patient, and which is obviously the only way I can look at it, as you know, in this country, we're all in some kind of healthcare system, a hospital system, a very large group of doctors. They're beginning to be across the country now, doctor groups, which is something
Hmm.
interesting. But they all use a separate piece of software, a
Yes.
portal for you to enter your information, for them to enter their information about your visit or your lab tests or whatever it might be. And each time you go to a new doctor in a different system for something else, perhaps, because at least with Medicare you're able to do that, and also with some other private insurance, particularly union-based insurance, often you're filling everything out again when it's already here. All I need to do is link it or send it to you.
That's a really interesting topic you bring up, and I do think we've made some significant strides in that. You may not be seeing it at the consumer patient level today, but it's improving. So I remember very, very specifically back, this is back in 2012. I was on, when I was doing my fellowship in Boston, I was on faculty at the Brigham and Women's Hospital, which is one of the Harvard Medical School hospitals, working in the ER trauma center. And I had a patient come in with, heart attack, stroke-like symptoms, very complex patient. And this was a patient, ambulance brought them to our ER at the Brigham. But this patient received all their health care for the last 20, 30 years or whatever at the hospital across the street at Beth
Uh-huh.
Israel Deaconess Hospital, which is another Harvard Medical School hospital. And what was really crazy was I had zero access to this patient's medical records. So here I am trying to provide life-saving treatment, diagnosis in real time, and they've got thousands and thousands of pages of medical records across the street, and I couldn't get the records in
Oh,
time. It was
oh
it
my.
was it was really just incredible and insane in so many ways. And we did eventually get those records, but it took several hours to get those
Yeah,
records
and that
faxed
could
over to
make a
us.
difference between life and death
Yes.
for some patients.
Yeah, but now today there's been this new really push for what's called regional health exchanges and now a national health exchange. It is much easier now to grab patient medical records from across the country. And so I'm actually really excited about that. I know there's a bunch of different companies that are working in that space to make it more accessible and easier for doctors and clinicians to have access to patient medical records. There's still a lot of work to be done there, but I am excited by that advancement.
And that would be all private companies, in a sense, who are putting these concepts
Yes,
together. So
yes.
that is already a public-private a partnership where public is involved, and if not, with private insurance, then it's just all private companies, which is just as good. But I think we're all interested in the big public programs, the Medicares, the Medicaids, parts of Obamacare, that could be streamlined, save a lot of money, and help a lot more patients if they were just more organized. And I think the concept of AI can do that. Or, I mean, if you think about something as simple as a Google search, and you now get this AI summary with a lot of warning that that's all it is, and all of your various references are below that AI summary. But if you're just looking for an overview as a beginning, it's right there. It saves you all this trouble of going through I don't know how many websites till you find the one that summarizes what you're looking for. And so you have a starting place, particularly if you start with no knowledge. It's particularly true for medical information because there's so much of it and there are so many good sources of it,
Mhm.
but you don't know where to begin. And I see that if that's happening right now, then it seems to me the way AI is learning and jumping in terms of ability, that's not something where I'm going to lose my job. It's where something where my job is going to be enhanced because I'm not going to have to do the grunt work. I can go right to where I need to go and start with the real work.
Yeah, like, I think there's tons and tons of opportunity there. Um, I do also think that we have to be careful. One thing as a doctor who still practices these patients, one thing that's generally difficult when you're interacting with patients when they historically would bring in their Google searches and said, I went to Dr. Google and I got all this information and I already know the answer, doc. And there's just unfortunately so much, it's not necessarily misinformation that's out there, but it's contextualized. Is whatever you found on the internet and out there, is that actually applicable to you, your
Right.
diagnosis, your treatment plan, and so forth? And there's a lot of nuances there. That said, I do think it's great for patients to make sure that if they can access high quality content, um, to be informed, right? I want my patients to be well educated. I want them to be informed. I want them to be asking questions and looking for more resources. And I think as long as we can have the right guardrails in place to help, get patients, legitimate information, it can really help their healthcare, right? Because at the end of the day, the more active you are in your own healthcare, the better outcomes you're going to have,
Right.
right?
Right. All right. To kind of wrap this up and get back to Tembo, how
Yeah.
long do you have? I mean, do you have a contract with Medicare, or how long do you have to prove? Because I assume that if this guide program is permanently included, it has to prove that it actually has saved money and saved, and has had good medical outcomes. So, how long do you actually have?
Yeah, so the guide program was created for 8 years, and so for the next 8 years, all the participants were in the guide program. Medicare is tracking all the data, right? So they're looking at clinical outcomes. They're also looking at the total cost of care, and obviously looking to measure the cost reduction in care through the program. And so it's assuming that the program is showing, continued positive data and outcomes, both on the clinical outcome side and on the cost avoidance side. Um, to my understanding, the program has up to 8 years to demonstrate that. And if it does, then, if you look at the history of the Medicare innovation programs, their goal is to then bring this to everyone, to allow any clinical provider, doctor, hospital to provide this level of care. And so with those CPT codes that we currently have for the guide participants, it'll be opened to anyone to provide those clinical services under those CPT codes.
So, in terms of Tembo or any successor company that comes along, um, are you? I should have asked you this at the beginning. Are you a for-profit or hopefully for-profit company or not?
Yes, we are a for-profit organization, and so our goal is to you know continue to grow and scale to help as many patients and families as we can. And so again, that's why I'm really excited for us to be able to soon serve the entire country, all 50 states, because the need is just so incredible.
All right, I think we'll leave it at that point on a hopeful note. And I don't know. I'd like to come back in 3 or 4 years and see what's happened, and perhaps we will. Thanks
Yeah,
very
yeah,
much.
that'd be great.
Thanks, Anurag. I really appreciate your coming on the podcast.
Awesome. Yeah, thank you as well. Appreciate the opportunity.
Dr. Anurag Gupta, founder and CEO of Tembo Health, on Tembo's mission to streamline dementia and Alzheimer's care using care navigators and digital tech. Tembo is partnering with Medicare's pilot guide program. I put a link to Tembo in the show notes. The website's making it very, very easy for anyone who wants to sign up for information or help to do so. In addition to running Tembo, Gupta is a practicing emergency room physician, and he has an MBA and is board certified in clinical informatics and addiction medicine. Now, in my next podcast, episode 34, my guest will be Amy Weatherby, PhD. She's a nationally known autism expert who's a distinguished research professor and director of the Autism Institute at the Florida State University College of Medicine. As you likely know, Robert F. Kennedy Jr., the new head of the Department of Health and Human Services, is determined to find the cause of autism by September of this year. That's 2025. So, what do we actually know about autism? How can you tell if your child might have it, and what help is available? Dr. Weatherby and I will discuss as many facts as we can cram into one podcast. Look for episode 34 to drop on the third Tuesday of June, and that's because I schedule just one new podcast a month. As always, please subscribe and share. The video versions on YouTube, audio on Apple, and on all other major platforms, including my host platform, the Podbeam website and app. Show notes and links on my website, stephanieshelton.com/conversations. I'm Stephanie Shelton. Take care of yourself and all those you love, and I'll see you again soon. Conversations on Health, How We Get There is produced and edited by Frank Harold. Research assistance from Dr. Richard Saltman, Professor Emeritus of Health Policy and Management, Rollins School of Public Health at Emory University in Atlanta.